for the very first webinar in our brand new ShillMed Lifestyle Education webinar series. I'm Emily Schill. I'm a registered nurse and co-founder here at ShillMed Weight Loss and Lifestyle Medical Center. I'll be your host tonight, and because there is no ShillMed without our patients, we are grateful to you for joining us here tonight. So as patients of ShillMed, our goal for you is to feel empowered, encouraged, and supported as you take steps towards improving your health and improving your quality of life. And because knowledge is power, a short fact session at the beginning of each week's webinar is intended to arm you with more information and evidence to support why you want to continue the hard work required to make these changes and how you can find reasonable ways to overcome your obstacles. So we found that by addressing the whys and the hows behind what we are asking you to do, it changes your confidence and your determination to keep going. So let's look at a few of the whys and the hows of our weight loss program and lifestyle program tonight. Here's a quick example. Why is weight loss so important and how can you benefit from it? Let me take you to our first slide here. Did you know that weight loss can significantly improve and lower your risk factors in every system of your body? I want you to take a look at this table for a minute. Some of the things that you see on this table will not be new to you. Most of you are already aware that weight loss can reverse diabetes type 2 if you have it, or significantly improve your symptoms and lower your medication need. If you don't already have diabetes, it can decrease your risk for developing diabetes. Same thing with heart problems. That's a pretty well-known fact that cardiovascular disease risk goes down with weight loss. But look at all of the pieces to this table that you may not have known. Did you know, for example, that weight loss can also increase testosterone levels in males? Or did you know that there are several different types of cancer risk that goes down with weight loss? Look at the list here: esophageal, head and neck, stomach, colorectal, kidney, gallbladder, etc. You may not have known that the cancer risk goes down so significantly. Hold on just a second. I lost my page. There we go. Look at the very first one on the top left-hand corner, mental health problems. Did you know that depression and anxiety symptoms can improve with weight loss? And I know that it says here, it talks about poor self-image, but I think it's important to note that while weight loss can change body image and increase confidence, what we're really talking about here with depression and anxiety is the chemical processes that change as the hormones change with weight loss, which then can affect your mental health status. So there are a lot of things on this list that can give you additional motivation and encouragement in your weight loss goals, beyond maybe what you already knew. So take a look at that and just make either a physical note or a mental note of some of the things that stand out to you. Fact number 2. Did you know, and this is going to focus more on our business side of things. Those of you who are already patients know some of this, but maybe some of these facts give you further motivation to continue on with our program. While ShillMed is a very new business and program, one of the many ways that we use to help you lose weight beyond basic nutritional, lifestyle, and physical fitness counseling and coaching that we provide, as well as medication options such as semaglutide, is we work closely with the OptiFast meal replacement program that has been used and researched for the past 40 years around the country. Now, here's some of the whys behind participating in the ShillMed OptiFast program. Did you know, for example, that the relative weight loss for the OptiFast participants was twice the weight loss compared with those in food-based intervention programs? And the reason for that, there are a lot of reasons for that. We won't go into great detail on them tonight, but as some of you are already aware, our meal replacement plan provides total nutrition and a stimuli narrowing dietary intervention. And we can talk more about that individually if you have questions, or in further webinar weeks. But basically, our well-tested and low-risk meal replacement plan provides great results and has for several decades, with all kinds of providers and patients using those all over the country. So that's the first way that this program has really worked well for a lot of patients. The second reason is that we have a multidisciplinary team of healthcare professionals that are both monitoring and providing support for your weight loss and lifestyle change needs. And right now on staff at ShillMed, we have our dual board certified physician who's certified in both weight loss and, obesity medicine and internal medicine, as well as we have nursing services provided by myself. And we also work with personal trainers and a local gym here in town to help you get started with your fitness goals. We are also currently working on bringing on a registered dietitian or nutrition expert to help patients who are transitioning from the meal replacements back to regular food to try to make a successful transition into healthy lifestyle behaviors and food choices. Now, the third piece, and this is really what we're here to talk about tonight, part of the great success with this program comes with the behavior modification and nutrition and exercise education piece. And that's what these weekly modules are all about. So we have weekly group sessions and we learn strategies. I like what it says up here. We learn strategies and behaviors for successful long-term lifestyle changes. So with that being said, we recognize that this program can be time consuming and demanding, especially in the beginning stages. And we're asking for a lot of your time throughout the duration of this program. So we want to make the following commitments to you through this webinar series and through our programs. Our commitment to you will be to do our very best to provide engaging content with valuable information. We've worked hard to make these worthwhile and effective for you. And the second thing is we're going to keep these to just 30 minutes per week. Now, the exception being when we meet as a group in the future, and we're hoping to provide group sessions, hopefully by the late spring, early summer. And some of those will be a lot more hands-on. And as such, we will end up taking a little more time than 30 minutes per week. But for the most part, our weekly webinars will keep to 30 minutes per week. Now, as you engage in this program, we ask the following commitments from you. The first is to come with an open mind, recognizing that changing lifestyle will require changing mindsets at times. And the second is to participate as actively as possible and as often as possible. So we recognize that each person's comfort level will differ with sharing personal information, and especially as related to healthcare information. So you should only share what you feel most comfortable doing. However, to start with, you're welcome to join anonymously. You're welcome to just use the chat window to participate, or you're even welcome to just personally take note of your answers at home and not share them with anyone, because even just the act of writing down your thoughts on paper will change your experience that you have. But as you are willing, we hope that you will be willing to share with others so that they can benefit from your insights and experiences and that they can benefit from yours. So in addition to the collaborative environment of conversation that we intend these webinars to be, you are also welcome just throughout the whole evening to ask any questions by just dropping a question in the chat window. Now, we ask tonight, since there are several people joining us, we're so glad you're here, that are not necessarily members of our program yet. If you have specific questions about the program itself, go ahead and go on our website and message us there. Questions for tonight should be related specifically to the webinar content so that our patients can benefit from our time spent here. So now I want to just provide you with a fun preview of what we have planned for you with these upcoming webinars. We are going to be mainly drawing from the lifestyle education modules that are provided to us by OptiFast, which is the program that's been used by hundreds of clinics across the country, and they've spent decades now researching the most effective ways to educate and help people with these behavior and lifestyle modifications. And so these modules, we've reviewed them. We have found them to be powerful and valuable and provide exercises that will assist you as you reshape your thinking on your journey to a healthier lifestyle. But in addition to the lifestyle education modules, we're also really excited to bring in a variety of guest speakers that we feel that can add variety as well as value to this program. So we're excited to introduce you to friends and specialists in all kinds of fields, people that can bring valuable information and insights from their personal and professional lives. We have a lot of physician specialists that we want to bring in that can give us all kinds of insights into their practices and what they're seeing in their practices and how it relates to you and your goals. We want to bring in all kinds of experts in the fields of nutrition and exercise and all forms of health, whether it be mental health, emotional health, physical health, all of the different types of health that lead to a holistic and whole experience for you. Now, let me just give you a preview for the next 2 months. I already have lined up in 2 weeks on Thursday, March 21st. We're really excited. Our first guest speaker will be Whitney Bean, and she runs the company Intuitive Lifestyle Coaching. And we're really excited to have her. She is an expert on emotional wellness, and she works with clients all of the time to increase their sense of emotional wellness and teach them tools that can help them in that area. So she will come, she will be prepared to answer your questions, to provide you with some insight into what she does and what she offers, as well as providing some free tools and exercises and some information on how you can increase your emotional wellness. So we're excited about that. In coming months, we have lined up a certified personal trainer and previous professional athlete who is going to talk to us about the importance of muscle building in all stages of your life and how it can help you with weight loss and with graceful aging and all of those things. We're going to bring in a registered dietitian who has previous experience working with patients post-bariatric surgery and helping them transition in their diets. And our very own Dr. Schill, who is board certified in obesity medicine, is going to come talk to us about what he's learned about obesity medicine and lifestyle medicine in ways that he doesn't have time to do when he's sitting one-on-one with you, discussing your one-on-one healthcare needs. So we have so many things lined up already, as well as so many great ideas. But I would just like to know if we could just take 1 minute here, drop in the comments which of those categories looks most interesting to you, or is there something that's not listed here that you would like to see us cover in this webinar series? The great thing about us being at the very beginning of this series is that we have the opportunity to shape it to meet your needs. So if you have any ideas for me, or if there's anything here that stands out to you, please drop it in the comments and let us know so we can take that under advisement as we plan for the future. I'll give you just a second to look over that list. And as we go along, if you have any ideas, go ahead and drop those in the comments as well. We're going to go ahead and move forward for the last half of this session, this short session tonight. And we're going to talk about the main topic that we have prepared for tonight, and that is assessing needs. It's going to be based on the survey that any patients received with their welcome binders. And if you receive, and you should have received it in an email prior to attending tonight if you registered with before about noon today. So if you didn't get a chance to see this survey, please go ahead and go to this website. Click on the file share and use the password webinar 2024. You can download that survey really quickly and just kind of follow along with us as we go. So let me just draw your attention to the first page, third paragraph, just right there where you see that black arrow. Just want to draw your attention to that first sentence. It says, our best research and clinical experience has identified the following areas as essential to weight loss management, to weight management. So as such, we've decided that this is our best starting place. So now going forward, assuming that you've come with the questions already filled out, and again, just jump in and participate as you can, I'm going to ask you to consider a few of the following questions. Question number 1, as you went through this survey and rated yourself as it asked you to do with a 1, 2, or 3, go ahead and just put a number 1 next to the category or 2, pick 1 or 2 categories that represents your greatest knowledge deficit. And what I mean by that is just which categories, not necessarily habits that you want to change or things that you want to do better at, but what are the places that you really just need to learn more? So I'll give you just a minute to kind of look over that. And these are the main categories that each have a bunch of subcategories under them. But pick 1 or 2 main categories that you would like to learn more about. I'll give you just a minute to look over that. Okay. Um, Now, the second question I have for you is this. What category or categories represent your greatest behavioral challenge? Now, that's a little bit different than a knowledge deficit. This is more the habits that we were talking about. So maybe it's a bad habit, or I shouldn't say bad habit, maybe a negative habit that you've been trying to kick for years and you kind of just keep going back to it and you struggle to really knock it out for good. Maybe it's a good habit that you're struggling to implement consistently. So just take a look. Again, pick the one or two categories that represents your greatest behavioral challenge and put a 2 next to those. I'll give you just a minute to look over that. Okay, so the reason that I wanted you to separate these beyond the original scoring that the survey did is that I want to address them a little bit differently in our practice. The first one, the knowledge deficit, is something that I really want to address in this webinar series. So if you'll take just a minute, drop me, if you're comfortable, your top 1 or 2 places that you would like to learn more about. Now, I know this is similar to what we did with looking over the list of experts that we want to bring in, but go ahead and tell me from the survey if there's additional areas that you feel that you would benefit from more information. I'll give you just a second to do that. I should add too, if you don't feel comfortable putting it in the comments, you're welcome to send me a private message. And we can cater the topics in the upcoming weeks to things that you'd like to learn more about based on what you've learned about yourself through this survey. Okay, so as you're continuing to think about that and leave those comments, we're going to move on to the second piece. And this is what's going to be your challenge or your homework for the week. What I want you to do with that second piece of information, the behaviors that you're struggling to change, I want you to take that information that you gained from going through this survey, recognizing where your weaknesses are, and I want you to bring that to your next doctor's appointment. We pride ourselves at ShillMed on being able to cater our treatment to your needs. And so behaviors that have been difficult for you to change in the past, we can come up with new solutions to help you overcome obstacles and roadblocks that have felt insurmountable before. Now, our long-term vision for ShillMed is to be connected with an entire team of specialists that can touch on all aspects of lifestyle and weight loss, anything beyond what we're capable of handling ourselves. Although I do want to just take a second and reinforce for anyone who's not aware, Dr. Schill is board certified, as we mentioned, in internal medicine and obesity, and has almost a decade of experience in treating complex disease processes. So part of the benefit of what you get by being here with us is that you're with a physician that's not only equipped to help you with the weight loss and lifestyle changes, but can manage a lot of your complex disease processes as well. Now, that said, there are certainly areas of specialty that we are not experts in. And so whether it be you're struggling with hormonal or endocrinology type problems, severe behavioral health issues, sleep problems, genetics, that kind of thing, we can connect you with experts in those fields if we are unequipped to handle your specific needs. But we can help you focus on the areas that will most benefit you. So that's what I want you to do this week. I want you to take that answer to number 2, bring it up at your next appointment, and let's see what we can do to focus on allowing you to have the most success. So we're going to do one more exercise in the last 10 minutes that we have here with this survey. Now, I want you to know that we recognize that the thought of making major lifestyle shifts can feel both daunting and discouraging at times. And that is oftentimes because we tend to focus on what we are losing with a lifestyle shift instead of what we're gaining. Now, clearly, there's a reason for every one of our negative habits that we want to get rid of. We may want to change them, but we also depend on them to a certain extent. And ultimately, no one will be successful in maintaining a lifestyle change that feels miserable to them. So that's part of why there's so many failed attempts, right? Is that we try to make these changes that are that are miserable for us, that we don't enjoy at all. And then because of that, they're not sustainable. So in order for a successful, real lasting change, those changes must be attainable. So think time and money. Sustainable, think I can do this long term. And I think this one's important and often overlooked, they must be appealing or enjoyable to you. So does that feel impossible? Sometimes when we think about making healthy changes, it doesn't feel like we can make healthy changes that are attainable, sustainable, and enjoyable. But I believe that we can do it. So first of all, remember two things. Part of the major benefit of the OptiFast meal replacement program is that it serves as a major reset. Resets are huge when making changes, and they're so much easier with a fresh slate. And the OptiFast program really kind of gives you that fresh slate. So that's the first thing to remember. Now, second of all, remember that just like bad habits, good habits have a cascading effect. So making one good change will motivate you to make another. And the more good choices you make, the more positive choices you make that improve your life, the better you'll feel and the less you'll even want to go back to some of the negative habits or behaviors that you've had in the past. But it has to start with one change that feels attainable, sustainable, and appealing to you. So now, recognizing that some of you are already on the meal replacements, let me give just a few examples of what this could look like. And if they aren't directly applicable to you now, think about how you can apply these apply these principles when you do transition back to food in coming weeks. So let me give you our first example. My husband hates running. Every time we've tried to go for runs together, it has not been sustainable. He hates it. I hate it a little less than him, which means that my sustainability in running lasts a little bit longer, but he loves to go biking. Now, the problem with biking is that it takes a lot of time, and you kind of have to have good weather, and he does best when he has a partner. And so when any one of those factors is out of play, it's hard for it to be sustainable. So about within this last year, about 7 months ago, he had a friend that invited him to just come over one morning a week to work out with him in his home gym. And that felt attainable and sustainable to his needs for time and what felt overwhelming to him. And he found that that one day a week was so much more, he felt so much better on that one day a week that then that turned into more than one day a week, which then turned into 5 to 6 days a week. And he found that those specific workouts that he was doing were actually really enjoyable for him. And so the combination of having somebody to do it with and also finding something that was enjoyable to him turned what used to feel like an insurmountable task into something that has become a hobby. And now he not only is consistent with it, but he seeks it out when we go on vacation. He finds a hotel gym or a local gym. When he misses his workout in the morning, he does it on his way home in the evening and that kind of thing. So what started small as just finding something enjoyable turned into a habit that has become sustainable for him. And I'm just switching over here to show you that I do not have the picture that I intended, but that's okay. So we will move right back to where we were. And let me go on to example 2. So are you worried about social eating? Maybe it's really easy to eat well when you're on your own or when you're at home, but when you go to parties or when you're at work events, it's really difficult because there's always good food around that you want to participate in. At our house, good food and good parties is a big deal to us. And so we find that that's one piece of our lifestyle that we don't necessarily want to give up. But take a look at your survey in section 2, number 4. It says, plan for a healthy snack before food-oriented social events to take the edge off your appetite. So that's a great example of a really simple, sustainable habit that you can adopt immediately without necessarily feeling like you have to overhaul your whole life and give up things that are really enjoyable to you. You can make these small changes that slowly train your brain and your body to eat less of the food that maybe is important to you and still get the same enjoyment with better results. So there's another example. Example number 3, if you look at section 7 about self-monitoring in line 3, it talks about reading food labels at the store. I don't know about you, but reading food labels in the past has felt really overwhelming to me. And, raise your hand if you're too busy to read all the food labels in the store. I know I am. But you can start small. This is another area where just a simple change can have a big effect. We know that added sugar is one of the biggest culprits in weight gain. So don't make any commitments today about what you will and won't buy. Just begin by educating yourself. Start by just looking at the label and seeing how many grams of added sugar are on all of the food that you're buying. Even if you don't make any changes right away in what you're buying, simply being aware of it will start to change your habits and start to change what you're looking for and start to change the things that you naturally gravitate towards and buy in the store. So small changes like that. One more. Let's talk about simple lifestyle modifications in section 6. Look over that list and see if there are any there that don't feel super overwhelming to you that you think, yeah, that's an easy one for me to do. Limiting the amount of TV we watch. If you love to watch TV at night, how can you change the schedule or change the amount or change what days of the week or change when you shut it off and go to bed, just so you can make a realistic small change to maybe improve your sleep or your physical activity levels. Walk on the treadmill while you watch your favorite show. What is one thing that feels like it could be fun and attainable to you that would make a positive change? What about taking the stairs instead of the elevator? When we were first married, we prided ourselves on saying always to each other and often to other people, we are a family who takes the stairs. And I remember as newlyweds, we would have so much fun racing each other up 16 flights of stairs of some random downtown building that we had to go up. And we certainly got out of the habit of that very quickly. But looking over this webinar tonight inspired me to start teaching our children again that we can be a family who takes the stairs. You can race with your family members, you can race with coworkers. This is something that doesn't take a lot of extra time, but a small, simple habit that can actually be fun and not too much extra overwhelm or change can really start to change the way that you approach common everyday tasks and places that you need to go. So, do any of these feel encouraging or attainable to you? Small, healthy choices, remember, they feel empowering, and in turn, they create motivation to make more healthy choices. So if you start small, you watch it cascade. And don't be discouraged by setbacks. Just keep starting over again, knowing that every time you start over, each time it will get a little bit easier. So with just 2 minutes left to go, if you're willing to share, drop in the comments, what is one thing that you feel like is attainable, sustainable, and enjoyable that's a change that you could make this week? And share with others so that we can encourage each other to make some of these small and attainable changes. I'm going to give you just 30 seconds to do that. If you don't feel like sharing in the comments, make a note for yourself. Make a note for yourself and challenge yourself this week to make one small, attainable, sustainable, enjoyable step for you. Well, our time has gone by quickly and we're already done. So thank you so much for joining me this evening. Next week's topic is a really great one. We're going to be talking about personal history. So you can look on our website for that module to be available. You can download it there and be prepared for a discussion next week. Next week won't be an introduction, so it will be a lot more interactive as we review the things that we've learned about our mindsets and our behaviors and our expectations and our thought processes in regards to how we viewed food and exercise and all of these lifestyle behaviors growing up and into early and later adulthood, and how we can work together to change some of those mindsets for the better. So we're really looking forward to seeing you next week. We hope that you'll join us again. Those of you who are not currently patients of ShillMed and want to learn more about our program, please message us on our website, and we will look forward to seeing you soon. Until then, have a great week. Remember, the future is bright. We are so glad you joined us here tonight. Thank you so much.